Hi, I am Sharon Knight, President and CEO of Hope Communities, and I am happy to welcome you to our Building Community Check-in today. We have started these check-ins because we know that there are many people who are feeling isolated during quarantine, and we want you to know that somebody is caring about you and someone is there to provide information and resources to you whenever you should need them. Hope Communities has been in this community for over 40 years, helping people with housing, educational programs, and support services. And the work that we do is very client-centered. So even with these shows, we're trying to talk about topics that people really need to know about. So this is a Facebook Live format. And if you have comments or questions during this show, you can write them in the chat function that is at the bottom of your screen. And I will try to keep track of that because we have a guest today, and so it's going to be really important that if you have questions, we can convey those. If for some reason we can't answer those questions today, we will get back with you with answers at a later time. You can also send us questions or comments at info@hopecommunities.org. And there's a lot of resources information on our website at hopecommunities.org. So hopefully you will get some great information today. And then if you want some more later on, go to our website or reach out to one of our staff members. So I'd like to give a little bit of news about the virus. I'm going to repeat something that I told you the other day, that Governor Polis has reported that there is free testing for COVID. So even if you do have insurance, you can go to get tested for free. And people who are asymptomatic but work in industries, essential businesses where they work with vulnerable populations, they can go to get testing even if they don't demonstrate any symptoms at this time. And there is a number for those people to call, which is 303-692-2700. And we will put that in our chat function. So if you are an essential worker and you need to get tested or want to get tested, you can call that number to find out where to go. We also just want to remind people, like I do almost every session, that we are in safer at home mode. We want people to be able to start moving out into the community again, but to continue to have social distancing, to wear your masks in public, and also to do the hand washing and other sanitation efforts that we've talked about many, many times. So I'm going to give you a quote, which I always do. My quote today is by Greg Anderson, and it is, "The single overriding objective in wellness is creating a constant personal renewal, where we recognize and act on the truth that each day is a miraculous gift, and our job is to untie the ribbons." That's the law of Esprit, living life with joy. I picked that because we are going to talk about medical things today. We are going to talk about wellness and some very important tips for you during this pandemic. I am very, very pleased that we have Dr. John Pierce, who goes by Dr. Rush Pierce, with us today. And he has been a primary care provider for over 40 years in New Mexico and Texas. He recently moved to Colorado a couple of years ago, and he is volunteering his services at DoctorsCare, which is a nonprofit that provides healthcare services to the public, Denver Public Health, and he also is a volunteer faculty member at the CU Anschutz Medical Center. He's married, he has 4 children, and he has 8 grandchildren, and he's obviously very active in the community, and we're so thrilled that you are here today to answer some questions. We picked some questions of things that we know people struggle with, and so hopefully this will be helpful to you.
Thank you, Sharon. Thank you for having me on your show. This is great.
It's wonderful to have you here. I appreciate it so much. And we have been talking quite a bit about the symptoms of COVID-19, the basic ones in terms of the difficulty breathing, the cough, fever, and a little bit about the other ones. But what we've talked about, as you heard, a little bit of the steps that we should take also to stop the spread. But what are some of the steps that may not be the normal ones that you think people really need to pay attention to at this time?
Well, I think I think two things are really important right now. We have told people from the beginning of this epidemic that there are these three big symptoms that cough, shortness of breath, and fever. And it is true that almost everybody who gets hospitalized with COVID will have those symptoms.
Mm-hmm.
But we know that there are people who have milder cases of COVID. Are there people who have some symptoms before they get sick enough to go to the hospital? And we have tried to alert the public, the public health people have alerted the public to some of these other symptoms that might suggest COVID. So some of these have been chills, muscle aches, loss of sense of smell or taste, or even tiredness.
Mm-hmm.
So we have previously said, if you think you have COVID, what you should do is you should stay home, right?
Mm-hmm.
You should stay away from people and self-isolate for 14 days. But recently in Colorado, our governor and health department has changed that strategy, and they really want the public to get tested. And I think that's important for the public to know that if you think you have COVID, we would like for you to get tested. And the governor and the public health department are making it easy for that to happen and free for that to happen. So I would say one thing that I tell people differently than I did a month ago is that if you think you have COVID, you should try and get tested.
And there are 32 sites across the state that people can go to for free testing.
And there are other sites, more clinics are doing tested.
Okay.
Denver Health is doing testing if you're a resident of the city or county of Denver. So I think, again, if I had symptoms, my first step would be to call my clinic if I have a clinic, or you can now call these free nurse lines and say, here are my symptoms. Do you think this is COVID? And if they said yes, can you help me get tested? Where should I get tested? And that's the steps that I would take.
And what about those other symptoms that are more kind of flu-like or cold-like?
Right. So, this is the thing that makes it hard, right? Because tiredness is one of those. Well, we're all tired, right? So, fortunately, nasal symptoms are not very often due to COVID. So this is a time of year when I and a lot of people have allergies in Colorado, right? And I sneeze and my nose runs and my eyes are itchy. It happens every spring. Fortunately, those are not the signals of COVID. So if you have your usual allergies, that's not something that I am worried about. But these other symptoms, so chills are not something that I usually have with allergies. Sore muscles and for sure fever are not something that I have with allergies.
So pay more attention to those.
Yes. But again, you can call one of these free nurse lines. The Department of Health has a link where there are many of them. You can call one and talk to a professional and say, these are my symptoms. Do you think I should get tested?
So don't try to be brave. Try to be smart about it.
Again, we have the message to the public has changed. We used to say, don't come to the emergency room. Don't go to the doctor. Stay home if you think you have COVID. I think now we still want you to stay home if you have COVID, but we'd like for you to find out, and the public health department would like to find out if you do have COVID.
Yeah, and in addition to wearing the mask, keeping the social distance, and cleaning hands, are there other things that we should be doing to help us not, to prevent the spread?
Right. So as you know, and probably have said on your show, different people have different likelihoods of getting a severe form of the disease or dying of the disease. So, and age is the first one of those. So 90% of our deaths in Colorado are in people that are over 60. So I think for the general public, one thing to be really thoughtful about is contact with people that are older or people that are in one of these other risk categories. We can go over those if you want, Bo. But so this is tough, right? This is tough for me because I have grandchildren. I'm over 60, and my grandchildren want to see me, and I want to see my grandchildren. So, so what do we do about that? My grandchildren have been nervous about seeing me. They do not want to give COVID to me, and I appreciate that love and thoughtfulness. On the other hand, I get a lot of mental health positivity by seeing my grandchildren. So I think if you're in one of those categories, that you're older, or if you're going to visit an older person, think more carefully about sitting 6 feet away. So what I do is I stay in the backyard and stay 6 feet away from my grandchildren. Now, that is really tough from a toddler,
No,
right? So the
yeah.
2-year-old doesn't understand that. She wants to jump up in your arms, right? So, but I think to be more cognizant about that with older people is really important. And for sure, we've had these really heartbreaking outbreaks in nursing homes and long-term care facilities. So again, my mother-in-law lives in a long-term care facility. We have just been heartbroken that we can't visit her, but we understand why we should not go into her room and visit her. Call her on Facebook or find other ways to communicate, but not actually go there.
Right.
Because remember, even though I don't have any symptoms, I still could be infectious with COVID, right? That's the really kind of unusual thing about this illness that makes it tricky for all of us. I think.
Right. You can't take any chances like that. So some people are so nervous about this
Right.
that they don't want to go out at all. And I'm thinking that some people don't understand what type of doctor visits even that they should make. What do you think are the types of visits that they should really stay on top of?
Right. So the message to the public has been put off preventive things, just go to the doctor unless you really have to. So that's kind of hard to know if you're a patient. What do I really need to go to the doctor for? I think some things are simple, right? If you break a bone or get a gash on your arm, you know that you have to go to the doctor for that. But what about sort of routine things? So one of the unintended consequences of those instructions to the public is I think people have unnecessarily avoided going to the doctor for things that they should go to the doctor for. And we know, for instance, in the last 2 months, that our childhood immunization rates in this country are down 50%. So those are things that your children need to get. They need to get on a particular schedule, and that you should not avoid going in for your routine childhood immunization. Yes, it's routine. Yes, it's preventive. We said those are the kinds of things to avoid, but childhood immunizations are something you should definitely go into your doctor for.
How about annual screenings that someone might have?
So I think those are the kinds of things you might put off, your annual mammogram or your colon cancer screen. It's a little trickier, again, say you have high blood pressure and you haven't had your blood pressure checked for a while, should you go in and have that checked? So those are the kinds of things that might be easy to put off or appropriate to put off. And again, I would call my clinic, my provider, my doctor, and say, hey, I'm overdue for my pap smear. Hey, I'm overdue to get my cholesterol checked. Is this something I can put off, or do you want me to go ahead and come in? I do think many clinics now, Sharon, have developed effective strategies to lessen the risk. Part of the fear people have is that there are going to be sick people in the doctor's office that might have COVID, and I'm going to be sitting next to them in the waiting room.
Right.
Most doctors' offices now separate sick people from well people. Many doctors' offices say, we're only going to have sick people come in at this time. Well, people are going to come in at a different time. Everybody is required to wear a mask. So I think that the risk, many things have been done to lessen the risk of catching COVID in the doctor's office.
Right. As one of my friends went recently and they took her temperature. She couldn't go in with the person that she was with. And they had to stay separate. So all of those things, lots of sanitation things, but
Right.
it was also, there was only one entrance into the building, so you couldn't just wander in.
Right. Going to doctor's offices, emergency rooms, and hospitals is very different now than it was before COVID. There are many steps that are taken to try to lessen the risk that people are going to catch COVID at one of those places.
So there's some different strategies that people would have to go through right now. What are some of those that they should be aware of? In terms of, for instance, you can't go in with somebody else.
Right. So yes, typically now, if you go to the emergency room or you go to the doctor's office, they only let the patient go back to the exam room. Now, if it's a child, they'll make an exception. But But sometimes that presents potential problems. So sometimes people go to the doctor with an elderly person who may have some memory problems, and that may not be apparent. So if I was taking my elderly parent to the doctor's office and that parent had memory problems, I would say to the receptionist, I know that you are probably not going to let me go back to the exam room with my mother, but I do want you to know my mother may have trouble remembering things. Is it possible for me to go back, or is it possible for me to communicate with the provider at the end of the visit so I understand that? So yes, typically just the individual goes back without someone else. So there's no need for 4 or 5 people to go to the doctor with grandma, because they're not going to let them even sit in the waiting room.
Oh, wow. So should people be bringing extra things with them when they go to the
Well, I
doctor?
think for sure, if you go to the emergency department, if you're sick enough to go to the emergency department, and there's possibility you might get admitted to the hospital. Of course, you don't know that when you go to the emergency department.
Right.
Nobody's going to be allowed to visit you in your room. So you need to be sure to take your cell phone, to take your charger, because that's how you're going to be communicating with your family if you get in a hospital. They are not allowing visitors now, except under unusual circumstances, like with children. They allow one parent to be there. If you're having end-of-life care, they will let one person visit at a time. So, but it's like my mother-in-law at the skilled nursing facility. You can't go in her room and visit her. So,
So you have to really be prepared. Think ahead, because you're not going to have probably multiple visits. You're just going to be able to try to get in there one time. So you want to have maybe patient history and things like that as well.
So I think many of my patients, and me included, when I go to the doctor, I have typically wanted somebody to be with me, to hear what the doctor or the provider said, because I would forget it or I might not understand it.
Yeah.
So you're not probably going to have that option. So I would take a piece of paper and take more notes than I used to, because my spouse is not sitting with me saying, did you hear her say that? No, I didn't hear my doctor. Well, she said that.
Yeah. I remember having a minor surgery once, and I thought I remembered everything, and I really remembered nothing.
Now, I think one of the advantages of this time is it is much easier to communicate by telephone. It used to be, when you called the provider's office, you usually talk to the receptionist and the nurse. It was hard to talk to the provider directly, but that's much easier to do now. So if you do get home and you forgot something, or you say, gosh, I forgot to ask this question, it's much easier now to call up and say, hey, can I schedule a time for the provider to call me back and go over this again in detail, or answer this question? Or, I forgot to tell them this.
Well, if someone doesn't understand the whole idea of telemed, whether it's Zoom call or using the phone, how should they approach that? I mean, there are some people who just aren't used to going to the doctors at all.
Right. So the default for almost all of us is just to use the telephone. And I think that across the country, more than half of these telehealth visits have just been by the telephone. So it's just like talking to telephone. We do have the option, and I think there are many advantages if you can actually see a person's face.
Yes.
So we get a lot of clues about a patient's condition based on their appearance. I think patients receive communication better. There's better communication both ways if you can see somebody's face. So there's an advantage if you can use the video part of the telehealth visit. That's usually pretty easy. Most of these applications are compatible with cell phones, so you don't have to have a computer. You can do it from your iPad or your smartphone. But if you don't have a smartphone, or if you're having trouble, just connect by phone, which again, more than half the time, that's actually what is happening right now.
Well, I've heard that some people have not even been going to the emergency room when they should go. What are those instances where they really need to go to the emergency room?
Right. So that has been another unintended consequence of the COVID pandemic. And our instructions, again, the early instructions were try to avoid going to the emergency department. I think the reasons for that were good. They were two. Number one, there were concerns that the emergency department, which were already busy, were going to have all these extra COVID patients and they wouldn't have the capacity to deal with the people that showed up. That was one of the reasons.
Being there with a bunch of people forever.
Right.
Yeah.
The other reason, there were concerns that you could catch COVID. Somebody who didn't have COVID would catch COVID by going to the emergency department where there were people who had COVID. So those were the two initial concerns that led a lot of the instructions initially to say, try to avoid going to the emergency department unless you have to. You know, as it turned out, again, here in Colorado, and I am very, very happy with the way things have gone here in Colorado with the leadership of our government and our public health department. I think we have really been at the front in Colorado. And as a doctor, I'm proud of what has happened in Colorado. So in Colorado, early on, the health department and the governor and the government urged emergency departments to get geared up to ramp their capacity, and that happened. So our emergency department's capacity is higher now. And if you happen to wander down the emergency, they're not as busy, actually, typically, as they used to be because they have this increased capacity.
Okay.
The other thing is, like hospitals and providers' offices, the emergency departments have put in place many procedures and steps to minimize the likelihood of catching COVID in the emergency department from somebody who has COVID. So again, separate sick people from well people in the emergency department. They don't have these hour-long waits in the waiting room anymore. People are spread out in the waiting room. People are wearing masks. People are getting screened. So, so those two things have made it safer to go to the emergency department. That's a good thing, because in our urging people to be nervous about going to the emergency department, people have put off going to the emergency department for things they need to go to the emergency department for. So again, we have learned that here in the United States, that emergency room visits for acute heart attacks are down 50%. So what does that mean? Does that mean that 50% of patients are having heart attacks less? No, that's not what happened. People are still having, it's just that people are waiting or not going. The same thing has happened with stroke. There have been some studies now that show that visits for acute stroke are down by about 40% in the last 2 months. And those are two things, heart attacks and strokes are two illnesses where early intervention, by going early, improves your chances of having a good outcome. So if you think you're having a heart attack, if you think you're having a stroke, it's important, if you are having one of those, to get to the emergency department urgently and to get treatment urgently, if that's what you have. The average layperson is not sure that they're having a heart attack. They're not sure that they're having a stroke. So chest pain, severe shortness of breath, being sweaty, those things would make me think those are things you need to go to the emergency department for. If you have trouble, suddenly having trouble with your speech or vision or weakness on one side of the body, those are symptoms of a stroke, and those are things that need you to go to the emergency department. You can get help deciding about that by calling 911. So they'll help you assess, and they'll send somebody out, but they'll help you assess over the phone. Yes, we think this is a heart attack. Take an aspirin. We'll have somebody there right away and get you to the emergency department. But it looks like in the United States that a lot of people, they're not even activating 911. They're just saying, oh, that was terrible chest pain. I hope it's not a heart attack. I'll go lie down and try and sleep it off. And that turns out not to be the best strategy.
Well, some of those symptoms you said, like the shortness of breath,
Or COVID too.
Or COVID
It
too.
could
And
be,
so,
yes.
you know, there also could be some people who say, well, maybe I'm getting COVID, I'm going to wait
Right.
and relax. But they shouldn't. They should
Right.
absolutely call on that one, right?
Yes. So again, I think because of our increased capacity, the wait times are less, and because of these procedures that have been put in place, the chances of catching COVID are much less. So people should have less fear of going to the emergency department and should use it appropriately. You shouldn't go to the emergency department to have your medications refilled. You can do that with your doctor over the phone. You shouldn't go to the emergency department for allergies. That can be handled over the phone. But these other things, the evidence suggests that people, on average, people have been too cautious, too nervous. They've overdone it a little bit.
Okay, yeah. Well, we want people to be healthy, so please don't put off what you really need to be working on and going to the emergency room for. So Good advice, thank you. So there's, are there some other general tips? I know you're seeing a lot of people in your volunteer work right now, and you've been following this closely. I agree that we have been doing a great job in Colorado, but and information is out there, but sometimes people aren't sure what's real and what's not.
Yeah.
So what do you think?
There are a lot of things on the news that are of variable validity or truthfulness or scientific correctness. So again, I think that unfortunately, right now there is some mistrust of our government, but I do think that the government health systems, the CDC, the Colorado Department of Health, they are putting out factual information that's scientifically based.
Mm-hmm.
So if you have a question, I would look to them for authoritarian information.
Mm-hmm.
The National Public Health Agency, the CDC, or the Colorado Department of Health, or your local county health department.
Yeah, and that's where we try to go for information
Yeah.
for people too, just because there are so many things out there, and one of the things I also say is that don't watch the news or read the news all day long because it could make you go nuts,
It does. And Sharon, one other thing that has really struck me is that how significant the mental health or wellness impact of this pandemic has been. I think it's been for a number of reasons. Part of it is there's this fear of getting sick, of getting very sick and dying. We have this period of time when we are socially isolated in a way that we've not been before. Our usual community support groups are just not working. People are not going to church. They're not going to their community centers. They're not going to their local bridge clubs. So those things which afford us and protect us with regard to wellness and mental health, those things are not working as well as they used to. So I have really been impressed with how many people are affected by that. And I think you have already had some programs about that. So again, I would urge people to be attentive to that. I think that I tell people three simple things. One is keep a schedule. Get up, decide when you're going to get up in the morning, decide what you're going to do for the day. Don't just have a free-floating schedule. Number two, I think something that's really useful is to spend a little time journaling, writing down what you're experiencing, what you're thinking. If nothing else, your grandchildren may be interested in that, or great-grandchildren. And then the other thing is to try to do something positive for your community, and there are even ways to do that from your house. You can call friends or call people in nursing homes or skilled nursing facilities or people in your church who may be isolated. There are ways that you can volunteer through the Colorado Department of Health website and through your agency. You probably have opportunity for people to volunteer in all kinds of capacities. And I think that makes us feel good that we're able to do something and we're not just hiding in fear all the time.
Well, I sure appreciate you being here today and doing your community service and sharing your expertise with us.
Well, it's been a pleasure.
It's been wonderful. It's just let us know if you have questions, and I could forward them to Dr. Pierce perhaps, and we will also follow up with you. We're almost out of time, so I am going to talk about the book review that will be coming up. Jamie Laurie, who is also known as Johnny Five, and he is the main force behind the Flowbots. He is doing a book review for us today that actually encompasses a few books, but really he's focusing on Le Petit Prince by Antoine de Saint-Exupéry. But he has some interesting twists in his review. I think many of us grew up with that book, and we know that it's really moving, and it can touch kids and adults. So he'll talk a little bit about that. But this book review will be posted in just a couple of minutes after this session. So I also want you to know that we've got lots of other books. We've posted the book reviews on our Facebook page, and many of them can be downloaded from the Denver Public Library. So even if you can't get out to the library, you can download those right to your phone or to your iPad and read some of these really cool books that we've been hearing about. I will be back with you on Friday. We're actually going to continue our conversation around wellness, but we're going to talk about exercises for relaxation and for toning that you can do from your home. So please come back Friday at 3. And for those people who were with me last Friday when I did the cooking show, our recipes are on our website, recipes and pictures of those dishes that we made. So check that out as well. I hope you are well. I hope you're taking care of yourself, and I hope you have a great day. Thanks for joining us today. Bye.
Bye.
Thank you.